Hello and welcome back to AP Psychology. I'm Miss Lee and we're still in Unit 8, Clinical Psychology. This video will be focusing on the treatment of psychological disorders. We have quite a few learning targets, so as I scroll through the pages, I encourage you to pause the video and look over the learning targets so that you can be assured that we're covering each of the appropriate targets to be successful on the AP exam. If you haven't done so already, go ahead and grab your notes and let's get started. All right, first, a little reminder of the history of treatment. We have touched on this a little bit when we were talking about the history at the very beginning of the course. Maltreatment of the mentally ill throughout the ages was based on irrational views. Many patients were subjected to strange, debilitating, and downright dangerous treatments. In this very old image, you see a patient undergoing an experimental facial stimulation treatment. Continuing through the history of treatment, Dr. Philip Pinel in France and Dorothea Dix in America founded humane movements to care for the mentally ill. It was then that we started seeing some major changes in how we treated the mentally ill. So first, an overview of the different types of therapies that we'll be discussing. There is psychotherapy. This is involving an emotionally charged, confiding interaction between a trained therapist and a mental patient. There are biomedical therapies. These use drugs or other procedures that act on the patient's nervous system, curing him or her of psychological disorders. Then there's an eclectic approach. This uses various forms of healing techniques depending on the client's unique problems. And this can include a combination of the psychotherapeutic and biomedical therapies, in addition to other therapeutic regimens. We will look at four major forms of psychotherapy based on different theories on human nature. Again, our friends, the psychoanalytic theory, the humanistic theory, behavioral theory, and cognitive theory. But first, let's see if we can decipher these questions. Your therapist asks you to try to remember your dreams. He also encourages you to review incidents in early childhood. Your therapist is most likely practicing what kind of therapy? Freudian therapy, cognitive therapy, behavior therapy, or humanistic therapy. Hopefully you think it's Freudian therapy. This is very psychoanalytic in nature because you're talking about dream analysis and childhood-related incidents. Here's another scenario. While focusing on several intrusive thoughts that had been bothering her recently, Jenny was instructed by her therapist to report any ideas or memories stimulated by these thoughts. Jenny's therapist was making use of a technique known as active listening, free association, systematic desensitization, or transference. If you aren't sure of the answer, stay tuned and we will cover this concept. Psychoanalysis. This is the first formal psychotherapy to emerge as psychoanalysis having been developed by Sigmund Freud. This is a picture of Freud's famous couch. Freud was dissatisfied with hypnosis, and he developed the method of free association to basically unravel the unconscious mind and its conflicts. In this technique, the patient lies on a couch and speaks whatever comes to his or her mind. During free association, the patient edits his or her thoughts to resist the feelings and to express those emotions in what they think is an appropriate manner. Such resistance becomes important in the analysis of conflict-driven anxiety. Eventually, the patient opens up and reveals the innermost private thoughts to the therapist, developing positive or negative feelings towards the therapist. This is known as transference. Some criticisms of Freudian psychoanalytic therapy. Psychoanalysis is hard to refute because it cannot be proven or disproven. Basically, it's really incredibly hard to put to any kind of research methodology that is consistent or valid or reliable. Psychoanalysis takes a long time and is very expensive, and this is basically because it's completely dependent on the psychoanalyst. Current psychodynamic therapies are used. Influenced by Freud, in a face-to-face setting, psychodynamic therapists understand symptoms and themes across important relationships in a patient's life. So they're taking those symptoms and patterns. They're looking at patterns for the patient's relationships and life choices. Interpersonal psychotherapy is a variation of psychodynamic therapy and is effective in treating depression. It focuses on symptom relief here and now, not overall personality change. Humanistic therapists aim to boost self-fulfillment by helping people grow in self-awareness and self-acceptance. So let's quiz ourselves once again. Humanistic therapies differ from psychoanalytic therapies in all of the following ways, except psychoanalytic therapists are more likely to encourage the client to take immediate responsibility for their feelings. Humanistic therapists are more oriented to the present and future rather than the past. Psychoanalytic therapists are more likely to emphasize unconscious process, or humanistic therapists are more growth-oriented. Hopefully you were able to pick out that A is probably the most likely answer here. Psychoanalytic therapists really aren't all that likely to encourage the client to take immediate responsibility for their feelings. Their current feelings really aren't as important as one might think. How about this one? Mackenzie's therapist believes that active listening is an extremely important component of therapy. He's probably a psychoanalyst, cognitive therapist, behavior therapist, or client-centered therapist? The answer here is D, and we'll get into a little bit more about that information in just a moment. And lastly, client-centered therapists emphasize the importance of exploring clients' childhood relationships with other family members, interpreting the meaning of clients' nonverbal behaviors, enabling clients to feel unconditionally accepted, or helping clients identify a hierarchy of anxiety-arousing experiences. Hopefully you were able to determine that C is the most likely because the humanistic perspective is all about unconditional positive regard and acceptance. Developed by Carl Rogers, person-centered therapy is a form of humanistic therapy. The therapist listens to the needs of the patient in an accepting and non-judgmental way, addressing their problems in a productive way and building the self-esteem. During the therapy session, the therapist engages in active listening and echoes, restates, and clarifies the patient's thinking, acknowledging expressed feelings. Okay, so let's move on to behavior therapy. In behavior therapy, there is an application of learning principles to the elimination of unwanted behaviors. So the focus is again on the behavior, not the why, not the what happened before, but what's happening right now and what is measurable. To treat phobias or sexual disorders, behavior therapists do not delve deeply below the surface looking for inner causes. So let's test ourselves. If a therapist tells a client, rank order the things that frighten you from least to most, the therapist is most likely practicing Freudian therapy, systematic desensitization, Gestalt therapy, or a token economy. Well, we haven't covered Gestalt therapy yet, and token economy really does not apply here, even though it is a behavioralist concept. It is likely systematic desensitization. A behavioral therapist uses classical conditioning techniques like counterconditioning. This is a procedure that conditions new responses to stimuli that trigger unwanted behaviors. It's based on classical conditioning and includes exposure therapy and aversive conditioning. All right, what about this question? John's therapist laces his alcoholic drink with a drug that makes John sick. After getting sick a few times, just the sight of the drink makes John nauseous. In this example, the conditioned stimulus is what? Hopefully you recognize that it is the alcohol here. It has now been conditioned to produce an unpleasant response. A therapist helps Rebecca overcome her fear of water by getting her to swim in the family's backyard pool 3 times a day for 2 consecutive weeks. Therapist's approach to helping Rebecca best illustrates either stress inoculation training, aversive conditioning, exposure therapy, or humanistic therapy. You may not be able to answer this yet, but you will in just a moment. It's exposure therapy. In this type of therapy, a patient is exposed to the thing that they fear and try to avoid. Through repeated exposure, the anxiety lessens because they habituate to the things feared. They no longer experience that response because they start to make fewer associations with something negative happening, and so they are less reactive to that stimulus. Habituation is the diminishing of a physiological or emotional response to a frequently repeated stimulus. For example, that new song that you love isn't so great after the 500th time you hear it on the radio. Exposure therapy is also sometimes called flooding, and in this example, the individual is actually training using a virtual reality device for various procedures in space. He's an astronaut in training. It can also be used for phobias like driving by using virtual reality technology. Systematic desensitization is a type of exposure therapy that associates a pleasant, relaxed state with gradually increasing anxiety-triggering stimuli very slowly. And this is commonly used to treat phobias. Think of it as exposure therapy in baby steps. This type of therapy was developed by Joseph Walt. In systematic desensitization, you first must establish the anxiety stimulus hierarchy. And this is an example here on your screen used for a phobia of public speaking, where the patient ranks the level of fear or anxiety. The highest is at the top. This probably looks similar to Maslow's hierarchy of needs, but it's a little bit different. In systematic desensitization, the client is slowly exposed to each level, but with each exposure, they pair the exposure with relaxation techniques and stimuli that helps the patient remain calm. Aversive conditioning is also called aversion therapy. It is a type of counter conditioning that associates an unpleasant state with an unwanted behavior. With this technique, temporary conditioned aversions to alcohol has been reported, a very specific treatment for a very specific condition. So basically, you could pair the negative stimuli with smoking cigarettes, nail biting, drinking alcohol, drug dependency, that type of thing. What might you pair with nail biting to counter condition the behavior? Consider what the options might be. Behavioral therapy also utilizes operant conditioning techniques. Operant conditioning procedures enable therapists to use behavior modification, and that's where the desired behavior is rewarded and undesired behaviors are not or are punished. Usually they are within reason ignored. A number of withdrawn, uncommunicative 3-year-old autistic children have been successfully trained by giving and withdrawing reinforcements for desired and undesired behaviors in a technique called applied behavior analysis, or ABA. In institutional settings, therapists may create a token economy where a patient exchanges a token of some sort earned for exhibiting the desired behavior for various privileges or treats. All right, let's move on to cognitive therapy. In cognitive therapy, people are taught adaptive ways of thinking and acting based on the assumption that thoughts intervene between events and our emotional reactions. We're able to control our thoughts and self-talk. Here is an example of how this might actually work. So you've got one scenario, two different paths. In both scenarios, the person has lost their job. The internal beliefs are different here, though. That's where the cognitions are challenged. The first one is an internal belief of I'm worthless and this is hopeless, and this can lead to depression. In the second path, the belief is that my boss is a jerk, I deserve something better, and there is no depression as a result. What about this question? A cognitive therapist would be most likely to say, that sounds quite frustrating. It isn't easy to be in a situation like that. Can you think of a more positive interpretation of what happened? Just say whatever comes to mind, no matter how trivial or irrelevant it might seem. And next time you start to feel anxious, you can use the relaxation techniques we've been working on. Hopefully by now that we've gone through all of the different types of therapies, you should be able to correctly identify that it's the interpretation that the person is using for the scenario. So correct answer is B. Can you think of a more positive interpretation of what happened? Cognitive therapy is used for depression. Aaron Beck suggests that depressed patients believe that they can never be happy. This is the thought, and thus associates minor feelings like failing a test, the event, as major causes for their depression. Beck believes that cognitions such as can never be happy need to change in order for depressed patients to recover. This change is brought into patients by gentle questioning. Rabin and colleagues train depressed patients to daily record positive events and relate how they contributed to these events. Compared to other depressed patients, trained patients showed lower depression scores. There are different types of cognitive therapies. So just basic plain cognitive therapy, this is where the thoughts, feelings, and behaviors are all influenced by each other. The therapy basis here is that shifting cognition allows for emotional and behavioral changes to take place. Rational emotive behavior therapy, or REBT, believes that most problems come from irrational thought. Therapy involves showing the patient their distorted thinking so they can eliminate it. This is one of the most controversial types of therapies. Cognitive behavioral therapy aims to alter the way people act. So they use behavioral therapy and the way they think, cognitive therapy. So it's kind of using the best of both worlds and is often referred to as CBT. All right, let's talk about stress inoculation training. Mike and Baum train people to restructure their thinking in stressful situations. When stressed about a test, the object is to train your thinking to look like this: relax. The exam may be hard, but it will be hard for everyone else too. I studied harder than most people. Besides, I don't need a perfect score to get a good grade. So it's basically training yourself to use these different ideas in a stressful situation. All right, so here are some of the other types of therapies. We have group therapy. Group therapy normally consists of 6 to 9 people and a 90-minute session, which can help more people and cost less. Clients benefit from knowing others have similar problems. Family therapy. Family therapy treats the family as a system. In fact, it's known as systems theory. Therapy guides family members towards positive relationships and improved communication. All right, let's talk about the biomedical treatment of disorders. Basically, we have a couple of different categories here. Let's start with pharmaceutical drugs. The rule of thumb is that when determining what a drug treats or how a disorder would be treated with drugs, you need to consider what is the neurological cause and how to fix that. For example, depression is an undersupply of serotonin, so how might a drug treat the brain of a depressed patient? The drug is potentially going to work in one of several different ways. Either it's going to stop the reuptake of the serotonin, or it's going to increase the release of serotonin from the axon. Antipsychotic drugs include chlorpromazine, or otherwise known as Thorazine, clozapine or Clozaril, Seroquel, Risperdal, Zyprexa, and these block serotonin and dopamine. Most block dopamine receptors. Usually the psychotic symptoms start diminishing within 4 to 6 weeks. Side effects can be pretty tricky though. Patients can sometimes suffer with sluggishness, tics, and other involuntary movements. This is known as tardive dyskinesia. And there can also be a lowering of white blood cell count and weight gain. A psychiatrist will be monitoring their patient in order to make sure that this does not happen. Anti-manic drugs include lithium or lithium carbonate or anticonvulsant medications like Depakote. Usually they're effective in reducing manic activity. Patients typically see results within about a week. Lithium can be very powerful, however. You have to be careful to not reach toxic levels. A psychiatrist will do blood draws on a regular basis in order to make sure that doesn't occur. Antidepressant drugs include selective serotonin reuptake inhibitors like Prozac, Zoloft, Celexa, Lexapro, and selective norepinephrine reuptake inhibitors like Effexor and Cymbalta. SSRIs only inhibit reuptake of serotonin, whereas SNRIs inhibit reuptake of serotonin and norepinephrine. And usually you see results within 2 to 4 weeks. Side effects can include dryness of mouth, constipation, headaches, and weight gain. Again, a psychiatrist will be monitoring their patient to make sure that everything is okay. Anti-anxiety drugs include benzodiazepines like Librium, Valium, Ativan, and Xanax. They work by reducing the intensity of responses to stimuli that signal punishment and frustration. And usually patients see results within a week. They should be used for a limited time period due to possible dependency issues. Side effects include drowsiness and reduced ability to concentrate. Lethargy and physical dependence are the long-term possible side effects that a psychiatrist is going to be very careful to assure does not happen. All right, a different type of therapy is electroconvulsive therapy. This is ECT. There's no real form, and it's usually only used to treat severe depression that has not responded to a more typical course of biomedical therapy. How it works is that a physician will pass electrical current through the brain using 2 electrodes placed on the scalp, and somehow it seems to reset the hypothalamus. As a result, it readjusts hormone levels. And we're not sure if this is what helps the symptoms of depression or not. Mood-altering effects are immediate. This is usually done in a hospital and is in a very controlled environment. Using today's methods of ECT, very small or limited effects on the memory can occur, yet much of the public still worries about the safety of ECT because of the stereotypical traumatic administration of this as seen in a lot of the movies that depict mental illness. And historically, this was not a very pleasant experience because patients were awake. That's not the case anymore. Psychosurgery is otherwise known as lobotomy. How it works is that a doctor is going to sever the nerves between the frontal lobe and the center of the inner brain structures. Side effects are, not surprisingly, permanent lethargy and impulsive personality. And that is it for the treatment of psychological disorders. In our next video, we will evaluate these different treatments. I can't wait to see you then. Bye for now.